Hello and welcome to today's session on heart sounds. I'm Shweta and I'm going to talk about heart sounds. What is heart sound? Let me give you a small example here. Uh, when you're doing something clandestinely within your room and you want to know if somebody is peeping in and seeing, what do? You keep a watch on the door. When you hear the slight muffling sound of the door, it gives you an indication that somebody is peeping into you. Similarly, the heart sounds give us an indication about the functioning of the heart, the valves of the heart basically. So, when the valves of the heart function accurately, we can assume that the flow of blood is also accurate. Therefore, it is important for a physiotherapist to know about these heart sounds. Auscultations are an important part of examination, and any medical professional should know about the production of these heart sounds. If the heart sounds are abnormal, it automatically indicates an abnormality within the flow of blood. Let us now look at the various valves of the heart. We have two pairs of valves known as the AV valves and the semilunar valves within our heart. As the name suggests, AV valves, these valves are present at the junction of the atrium and the ventricle. These are the AV valves. This is the tricuspid valve and this is the bicuspid valve. These valves prevent the backflow of blood from the ventricle to the atrium during an systole. As you can see, these valves are thin in nature and they do not require much backflow to cause its closure. The next set of valves are known as the semilunar valves. These are present at the roots of great vessels. The aortic valve and the pulmonary artery valve are known as the semilunar valves. They prevent the backflow of blood from the great vessels to the ventricle during an diastole. As you can see, these are thick and heavy valves. Therefore, they require a backflow of blood to cause its closure. And the backflow of blood lasts for a few milliseconds.